In 2009, CHOP and Princeton entered into a partnership whereby there are pediatricians and neonatologists in-house 24 hours a day, 7 days a week. The pediatricians take care of patients on the pediatric floor and in the emergency department, and the neonatologists take care of the children in the NICU as well as attending high-risk deliveries.
One thing is clear, that pediatric patients are not just little adults. It's really important that we have the right providers seeing the right patients at the right time.
We actually have a CHOP pediatrician in the ER between the hours of 2 and 10 p.m. And what will happen is if the patients come into the ER and meet certain criteria, the pediatrician will see them directly. We try to streamline their care.
Having a CHOP pediatrician on site 24/7 and also dedicated to the emergency department during peak times, it allows a continuation of care between the outpatient offices and the emergency department.
We have a direct line of communication with their pediatricians. So we call them about all patients that are seen here in the ER. We make sure they get a copy of the lab tests, and we make sure that the follow-up plan is complete so that the family knows what to expect. It's very helpful if the family walks into the pediatrician's office the next day and they already know why the patient was seen and what the follow-up appointment is for.
Bringing a child to the emergency department can be a stressful time for both children and family. So I'm really proud of the service that we provide pediatric patients that really address the needs, both the social needs and the medical needs of those patients. All of our emergency nurses are certified in pediatric advanced life support.
We've had many of our nurses go down to CHOP and get experience of working down there to make sure that we're providing the same level of care here that they would down at Children's Hospital, and yet the parents can stay in the community with which they're most familiar. Our pediatricians have the experience, and to have access to the subspecialist down at CHOP is huge.
Our emergency department provides exceptional service to pediatric patients, and I can say this from the position of chairman, from emergency physician, and I can also say this from the position of parent, father who's used the emergency department for both my children. We provide great care.